The next two are dealing with the lunate dislocation, the scapholunate disassociation. So we have our Ballottement or Reagan's test. And you're going to do this test if the patient comes to complaining of pain and swelling on the dorsal side of the carpals. We want to have the patient, when we're doing this test, they're going to be in a relaxed, pronated position. We're going to take one of our thumbs and go on the triquetrum. The other one is going to go on the lunate. And we're simply just going to do, relax. There you go. Anterior posterior translation. So I'm just pushing one posteriorly, one's coming anteriorly, and then I'm switching. Okay, and we're just looking for laxity, pain, or crepitus in that area, which is going to indicate to us that there's potentially a dislocated lunate in that area. Remember that if we have a continued dislocated lunate, fractured lunate, that can turn into Kienbach's disease, so we need to make sure that we are paying attention to and referring that condition to prevent that from happening. And a Watson's test is going to be for a scapholunate disassociation, and this is going to be, you would do this test if you were thinking that there is some sort of subluxing or shifting going on with the scaphoid. So what you're going to do is you're going to find, let's do it like this maybe, you're going to find that scaphoid, again find that anatomical snuff box, find your scaphoid in there. You're going to also then take from the palmar side as well, so you're going to kind of have a grip on both sides there. And what we're going to do, you can see she's kind of in an arm wrestling position, and then I'm going to be applying can't see because my hand's there, an anterior posterior translation there while we're ulnar and radial deviating the wrist. Okay. This is not the easiest to do on camera here. And we're going to be ulnar and radial deviating as well as doing the anterior posterior translation. Okay, can you go? Oh, you might go slower. Okay, and then I'm going to be trying to do anterior posterior with that. What's going to happen? What will be a positive for that? There would be a reproducible pop and noticeable pop. Which is going to lead you to think that there's a disassociation of that scapholunate. Be careful though, this can pop up bilaterally, non-pathological. So it doesn't necessarily always mean that there's something going on there when that's popping up.